Follicular lymphoma is a rapidly changing field. We are seeing a much better understanding of the disease and prognosis, clinical behavior, and more recently we have new evidence that the majority of patients will do very, very well, but we're starting to identify a fifth of the patients who will do poorly. These are patients who progress within the first 2 years, and these patients are destined to have a 5-year overall survival of only 50%. In contrast to others, the overall median survival these days is measured in decades, which I always stress to my patients when they first see me. But there is this 20% of patients who have this dismal prognosis, and we don't yet really have a good way to identify them from the get-go, from the start. And so we're caught with waiting until these patients declare themselves and then trying to identify new strategies for them. So going forward, we need to be able to pick them out from the start, but we also need alternative approaches for these patients. The others are easy for the most part, and they, I like to use the metaphor of a marathon rather than a sprint. And so for that 20%, we're really under great pressure to identify new options for them. The others do well regardless of what we do, and that's why it's so difficult to show any intervention improving overall survival. Those patients generally respond, progress, and we have the pleasure of seeing them for many years.